And Team Duckworth playing this game, and it should be so obvious, guys. They're pitting us against each other. Look what they're doing. I want to put the rich man against the poor man, men against women, straight against gay, students against seniors. This president is just, it's unbelievable how politically, how so cynical he is. But you know what? It's not, because he just doesn't understand the country. He never has. So pitting this notion of increasing taxes, I'll never do it because philosophically I don't believe in it. It's your money no matter how much money you make. But it won't do anything to change the debt course we're on. Let me read you a quote. This was from about 6 years ago. It's gotta go like this. The major driver of our debt, everyone here knows it, is Medicare, Medicaid, and our health care spending. Everyone in DC knows it. You know who said that? 6 years ago, President Obama, when he was a senator. Everybody knows it. This is not complicated. 10,000 Americans are retiring every day. Hallelujah! I'll give you another hallelujah. We're living till we're 92. Okay? We're not dying when we're 62. This is a good thing. But what's not a good thing is the cowardice our politicians have had, because nobody wants to talk about how we're going to pay for all that health care for all of us who are living longer and longer. And all the Democrats want to do is just throw everybody on government health care. Ooh, I don't know. Again, I don't care if it works. I don't care if it will lead to death panels. I don't care if we can afford it. The Republicans have got to say no. No. I want my government to be a safety net. When it comes to health care, I want the government to be there for those who can't get it out in the marketplace. But for the rest of God's children, we're keeping more of our own money, and we are responsible for our health care costs. You will never solve this problem unless we finally grow up as a country and demand our politicians do that. Yes, sir. Doc Bell, over in the corner. Here. How come, boy, I hope nobody gets sick. All the doctors are here. Hold that close to you, Doc Bell.
Congressman Walsh.
Now,
I know you're going to shoot.
Point of fact. This is for the record. He does not have to call me Congressman Walsh. This was my high school doctor. He's given me probably 10 physicals over the course of my life. He can call me whatever he wants.
I think I'll just call you DRE. Okay, now, I know that we're at a time when you want to get out of here, but I thought I tried to summarize this morning because we're all so confused.
But let me stop you, Doc Bell.
Go ahead.
I don't want to get out of here. Look at this. I was panicking because I didn't know how many people would show up. I went to bed in D.C. Thursday night, and I called my staff, and I said, I want a huge rally, town hall on Sunday. Doggone it, get 200 people there. Look what happened. This is what's going on, guys. We're taking the path. Beautiful. Beautiful. This is your country at stake. Look, if you want to leave, leave. Thanks so much for coming. I'm not going anywhere. Go ahead, Doctor.
I can affectionately call you Joe.
Yes.
But simply put, later in this discussion, if I take a little longer than a simple question, I tried to summarize this morning as a practicing physician, a Medicare provider, and a Medicare recipient. I thought I'd try to summarize because this is very confusing for everybody. So the first point I think that Joe has made so dramatically, in this bill, our liberties are being compromised. I don't think anybody has any qualm with that statement. Now, getting back to some of the nitty-gritty. There was a question to Dr. Bianchi a bit ago about how he could handle a situation where he was forced to go against his Hippocratic oath. I have said to my patients for years now, until we get tort reform in this state, we're going to have difficulty practicing medicine. But one of the points that Dr. Bianchi made, and was asked of him, was that certain testing is going to be eliminated by this bill. Now, where does that put the doctor? The doctor today, without tort reform, is ordering a plethora of tests, many of them unnecessary, most of them creating an unimaginable cost for the patient and whatever plan that patient is on. Now, if we eliminate certain tests, what does that mean? Well, it means that we no longer, without tort reform, can protect our back ends, because now if we miss a test and somebody, God forbid, has a problem, we can get sued. And this is exactly what Dr. Bianchi was dealing with. So let me make, I'm going to try to summarize this.
I've been waiting 40 years to cut him off. I'm going to do it. No.
Costs are going up, reimbursements are going down. That's the general principle. This plan does not gear our people for specialized medicine, which is what's made our country so magnificent as far as medicine is concerned. 85% of those involved will pay for 15% of those involved. Many of our services will be taken away. These are my conclusions. It doesn't mean they're right, but I think they're probably pretty close. This bill affects the delivery system of quality health care.
One more.
I've got three.
Quickly! Quickly!
One of the main points tonight was that the doctor-patient relationship is being further destroyed and compromised. Under this, it's going to be taken away completely. And as many of you know, this kind of plan will not allow us to deduct certain things, such as HSA. And in fact, what we're being forced to do is to practice 1950 medicine, which for most of us is not acceptable.
Thank you, Dr. Bell. Thank you.
I want to take one point to what you said.
What?
Hallelujah, you said, for the fact, and I can't quite remember what it was, but you were saying hallelujah.
I do a lot of hallelujahs.
But it's going to come in, what, 9 years, you said? I think it's going to come a lot sooner when we'll be taxed.
Thank you. Hey, quick point, quick point. Moms in the audience, who's got a war on women? Because of Obamacare, doctors are leaving the profession in droves. Moms, who's got a war on women? President Obama does. Tammy Duckworth does. The Democrats do. Anybody who would vote for this thing, who supported this thing, is driving doctors out of the profession. Shame on them.
Joe, let me make one more point. One quick point. Go home and look at how many doctors are accepting Medicaid patients. There's nobody that you would want to take your dog to that's accepting Medicare for the most part. Consequently, what are we to do?
Thank you. Yes, sir.
Thanks, Joe. As a practicing physician whose kids think what he does is cool, I want to know how a bill that puts 30 million more people into the healthcare system doesn't add one new physician to take care of those physicians, has a policy in place that doesn't do anything but, as Dr. Bell said, usher physicians out of their field maybe 5 or 6 years earlier than they would retire. Put 16,000 more IRS agents into the picture. I had to go to medical school. Before that I went to college. I went to specialty school, internal medicine school. Why would somebody, as cool as my kids think I am in the hospital, why would anybody want to go to medical school today? I mean, because it costs a hell of a lot of money to go to college, it costs a hell of a lot of money to go to medical school. You're deferring all this income, and in that plan, that Obamacare plan, within there, you'll find that they believe that all physicians should be reimbursed the same. Who would spend that much time developing a career, a profession? Engineers wouldn't do it. Dentists wouldn't do it. Why should doctors be in a position, lawyers certainly wouldn't do it, but why should doctors be in a position where you have somebody telling you what you can make? Why would they go through all that school? Well, I wouldn't do it. A second time, I don't think.
Thank you.
You got a job.
Thank you. Wait, John, all the way in the back. Who's all the way in the back?
Me?
Well, I mean, you're better at it. You're as good as anybody.
I'm going to answer the doctor's question. I'm going to answer your question, doctor.
What?
When you go to school, medical school, toadies, government toadies will go to medical school, and they'll have more doctors than we need, because the government will start running medical school, and so on and so forth. That's the answer to your question. And I respect you, and I respect your answer. But I'm telling you what I think the answer to your question. Government toadies will go to medical school. They'll need to work for less, sacrifice their morals and ethics for the government.
Thank you. Who's got one? Yes, ma'am, right up here. Hey, folks, how many people, we'll take a few more. And guys, honestly, I don't mind staying at this. If we'll keep going.
How many in Congress who voted for Obamacare are willing to live under the same health care system? And also, if not, they have a Cadillac plan. How much will they have to pay for their Cadillac plan?
Well, great point. Here's the obvious thing about politicians. They make these rules for the rest of us, and they don't live under them. Remember, when they first designed Obamacare, they exempted themselves from it. It caused a huge public outcry, and so they begrudgingly put themselves back into it. But I can tell you, as someone who turned down his congressional health plan, and I turned it down, they have a phenomenal plan. It's a great Cadillac plan, better than what most Americans have. Yes, ma'am, right here, John.
Thank you. Listening to some of the talking heads on TV, they're saying, how is a candidate Romney going to handle the Massachusetts medical program that he put in place? Since it appears to be similar to the Obama plan, what's your thoughts?
You know, again, like everything, he's just got to be direct and strong. And he's got to say, look, here's what I believe. I believe in a constitution, and in my country, and then the Constitution says, you know, states can experiment with things that they want to do, but state governments have very different powers than the federal government. And the federal government does not have the power, should not, I don't know how the Supreme Court ruled, but should not. And states should be free to try and experiment with whatever they want to experiment with. But he does not, and he believes in that, and he does not believe the federal government should impose a huge program on everybody. I wish he'd say that. Now, I wish he said that, hey, I tried it, and it was a mistake in Massachusetts. I wish he'd say that. He's not quite there yet. Hold on. Quickly.
There was an article in the Herald about 2 days ago by a
Use that, please, right next to you.
there was an article in the Herald about 2 days ago by a columnist that you all recognize. I can't think of his name right off the bat, but it spells out what's happening in England. That country is heading for over the cliff. They don't know how they're going to pay for the healthcare system, and it really spells out what we're in for, and it's the death panels, and everything has to do with cost.
Thank
so
you.
wait, let me finish. So I bought 50 copies